Welcome to another episode from the Veterinary Medicine Digest. Today we are embarking on an exhaustive exploration into the complex and often overlooked world of companion rat health, specifically focusing on the intersection of respiratory disease and neurological complications. The centerpiece of our discussion is a groundbreaking retrospective study titled Concurrent Respiratory Pathology and Intracranial Extension are Common in Companion Rats with Otitis Media and Interna, authored by Julianne McCready and her colleagues. This research, covering cases from 2011 through 2025, provides a profound leap in our understanding of how ear infections in rats are not merely localized issues, but are frequently part of a systemic syndrome involving the lungs and the brain. To appreciate the gravity of this study, we must first establish the broader landscape of pet rat medicine. For many years, our knowledge of rat pathology was almost entirely derived from laboratory settings. While laboratory rats are genetically standardized and kept in highly controlled environments, the companion rat, the pet that lives in our homes, faces a much more diverse set of environmental challenges. In 2015, a pivotal study by Ray and the Remora team looked at 375 pet rats in France to determine what actually makes these animals sick in a real-world setting. They found that respiratory disease, specifically rhinitis, was the single most common reason for presentation, followed closely by mammary gland tumors and skin parasites. This study was revolutionary because it highlighted that an inappropriate environment, factors like poor diet, inadequate housing, or suboptimal ventilation, was a major risk factor for the development of respiratory disease. It established that for pet rats, the lungs are often the first line of vulnerability. However, the medical community began to notice that respiratory signs often masked or coincided with other severe pathologies. This brings us to the work of Sarah Faye Fearman and her team, who in 2022 published a study on lymphoma in companion rats. They discovered that nearly half of the rats presenting with respiratory distress were actually suffering from lymphoma, a form of cancer that often manifested as masses in the chest or mediastinum. This underscored a vital lesson in exotic medicine. What looks like a simple infection on the surface is often a sign of a much deeper, more complex process. It is within this context of diagnostic uncertainty and multisystemic disease that we must view the ear infections of the rat. Before we dive into the specific rat data, it is helpful to look at another popular small mammal where ear disease has been studied extensively: the rabbit. In rabbits, head tilt is a classic and distressing clinical sign. A 2024 study by Theophanis Liaudis and colleagues in the United Kingdom found that the most common causes of head tilt were otitis media and interna and a parasitic infection called encephalodisum caniculi. Much like what we see in rats, rabbit ear disease often begins as an ascending infection from the respiratory tract, moving through the eustachian tube into the middle ear. Another study by Dauberstein in 2023 explored surgical outcomes for these rabbits, noting that while complications like facial nerve paralysis are common, surgical intervention can be quite successful if performed early. These rabbit studies provide a comparative framework showing us that in small mammals, the ear is a gateway between the external environment, the respiratory system, and the central nervous system. Now let us turn our full attention to the McCready study on companion rats. This was a multi-institutional effort gathering data from 4 major veterinary universities in North America: Oklahoma State University, Louisiana State University, Tufts University, and the University of Guelph. They reviewed the records of 23 rats that had a confirmed diagnosis of otitis media or interna through imaging, necropsy, or both. The first major finding of this study is staggering: over 78% of rats with ear disease also had concurrent respiratory disease. This strongly suggests that in rats, just as in rabbits and calves, the pathogenesis of ear infection usually involves the movement of bacteria from the upper respiratory tract through the eustachian tube into the tympanic bulla. The researchers found that the average age of a rat presenting with these issues was approximately 19.5 months. This is a critical period in a rat's life, as they are approaching their senior years. At this age, the cumulative effects of chronic respiratory carriage, such as Mycoplasma pulmonis, often begin to manifest as clinical disease. Mycoplasma pulmonis is a ubiquitous organism in pet rats, ranging from asymptomatic carriage to severe pneumonia, and, as this study confirms, it is a significant contributor to otitis. In one case within the study, next-generation sequencing identified 100% Mycoplasma pulmonis in the purulent discharge taken from a rat's ear. The clinical presentation of these rats was varied and often dramatic. Neurological signs were common, including the classic head tilt, which was seen in 9 of the rats. Other signs included ataxia or falling, circling, and dull mentation. Interestingly, some rats presented with more subtle signs like increased respiratory effort, nasal discharge, or even dental issues like incisor malocclusion. This variety of symptoms can make a definitive diagnosis difficult without advanced imaging. The study highlights that 17 of the 23 rats had signs suggestive of ear disease, but 6 rats were diagnosed incidentally, meaning they were being seen for other problems when the ear infection was discovered. This leads us to the critical role of diagnostic imaging. The McCready study makes a very strong case for the use of computed tomography. While radiographs have historically been used to look at the skull, this study found them to be largely non-diagnostic for middle ear disease in the cases where they were performed. In contrast, computed tomography was able to identify thickening of the tympanic bullae and the presence of soft tissue or fluid within the ear canal that shouldn't be there. One of the most fascinating aspects of the imaging data was a case where a repeat computed tomography scan, taken 112 days after the original, showed a complete resolution of bilateral otitis media following treatment with enrofloxacin and doxycycline. This proves that with early detection and aggressive medical management, these infections can be cured. However, not all cases have such a positive outcome. The study revealed that nearly 1/3 of the rats had intracranial extension, meaning the infection had spread from the ear into the brain. Histopathological evaluation during necropsies found evidence of meningoencephalitis, rhombencephalitis, and even intracerebral abscesses. This spread can happen through direct extension, where the infection eats through the thin bone of the temporal region, or potentially through systemic spread, although direct extension appears more common in these findings. Case 6 in the study provided a vivid example of this, where computed tomography showed severe wall osteolysis of the tympanic bulla with the infection extending into the brainstem. The microbiological findings were equally enlightening. While Mycoplasma pulmonis was a major player, the researchers also identified a wide variety of opportunistic bacteria including Staphylococcus aureus, Bordetella bronchoseptica, and Streptococcus pneumonia. This diversity suggests that chronic respiratory disease may damage the local defenses of the respiratory and oral mucosa, allowing common environmental bacteria to take hold and cause severe suppurative infections. It also highlights why a broad-spectrum antibiotic approach is often necessary, although culture and sensitivity should always be the goal when possible. Treatment in this study was primarily medical. 17 rats received antibiotics, with doxycycline and enrofloxacin being the most frequently used combination. Some rats also received meloxicam for pain and inflammation, and a few were given corticosteroids. 2 rats underwent a procedure called a myringotomy, which involves making a small hole in the eardrum to drain fluid and collect samples for culture. While myringotomy is more common in species like guinea pigs, its role in rat medicine is still being defined, though it offers a valuable diagnostic and therapeutic tool for managing the buildup of purulent material. The prognosis for these rats was generally guarded. Survival times ranged from 0 to 341 days, but many rats survived less than 10 days after their initial presentation. The study notes that the high rate of euthanasia often complicates our understanding of the natural progression of the disease. Owners frequently choose euthanasia when faced with severe neurological signs or the prospect of expensive long-term care. However, the cases that were diagnosed incidentally and treated early had much longer survival times, some exceeding 4 months. This emphasizes that otitis media and interna is not necessarily a death sentence if caught before it reaches the brain. One of the most important takeaways from the McCready study is the need for clinicians to be vigilant. Because respiratory and neurological signs are so intertwined in this species, a rat presenting with a simple sneeze might be harboring a brewing ear infection, and a rat with a head tilt almost certainly has involvement of its lungs. The researchers suggest that advanced imaging, particularly computed tomography or even high-frequency ultrasonography of the bullae, should be considered much earlier in the diagnostic process than is currently standard. Furthermore, when a rat does pass away, a thorough necropsy that includes a careful examination of the middle and inner ears is vital for our collective understanding of this condition. To broaden our perspective even further, we can look back at the laboratory research conducted on Wistar rats by Verdiger and colleagues in 2006. They found that 20% of conventionally housed laboratory rats developed spontaneous otitis media, even when they appeared healthy on the outside. This laboratory data supports the idea that ear disease is a hidden epidemic in the rat population. Interestingly, they also used brain auditory evoked response testing to show that even mild infections could cause significant hearing loss, a factor that pet owners might not notice but which certainly affects the animal's quality of life. We must also consider the role of other diseases that mimic otitis. Pituitary tumors are another common cause of neurological signs in senior rats. As McCready notes, there is a significant overlap in the age and clinical presentation of rats with pituitary tumors and those with otitis interna. Both can cause a head tilt, ataxia, and proprioceptive deficits. In 2 cases in our study, rats were actually found to have both conditions simultaneously. This complexity is why a thorough diagnostic workup, including imaging that can see both the ears and the brain, is so essential. As we conclude this deep dive, we are left with a much clearer picture of the companion rat as a complex patient. We have moved beyond the era of treating every rat sneeze with a simple course of antibiotics without further thought. We now know that the respiratory tract, the ear, and the brain are part of a continuous pathway of potential infection. The work of McCready, Ray, Fay Fearman, and others has shown us that pet rats deserve the same high level of diagnostic care that we provide to dogs, cats, and rabbits. By using computed tomography to catch ear disease early, by understanding the ubiquity of Mycoplasma pulmonis, and by recognizing the systemic nature of these infections, we can significantly improve the welfare and survival of these beloved companions. The study of 23 cases might seem small, but in the world of exotic animal medicine, it is a monumental contribution. It challenges our assumptions and provides a roadmap for future research. We need more prospective studies comparing different treatment protocols, such as the use of nonsteroidal anti-inflammatory drugs versus corticosteroids, and we need to further explore the role of surgery in managing chronic ear-base abscesses. Every case, every scan, and every necropsy brings us closer to a future where these intelligent and social animals can live longer, healthier lives. Thank you for joining us for this extensive look into the intricacies of rat medicine. It is through the dedication of researchers like those we have discussed today that the field of veterinary medicine continues to evolve, ensuring that even the smallest of patients receive the very best of care. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.